Hello everyone, welcome back to my YouTube channel. I'm back with another video. In this video, I will tell you about respiratory hygiene cough attitude. So let's start it without wasting the time. Respiratory hygiene cough attitude infection prevention measures are designed to limit the transmission of respiratory pathogens spread by the droplet on air routes. The strategies target primary patient and individual occupancy patient to dental setting who might be undiagnosed transmission respiratory infection but also apply to any more, including DHCP with the signs of illness including cough, congestion, runny nose, and increased production of respiratory secretion. Respiratory hygiene cough acute infection prevention measures are designed to limit the transmission of respiratory pathogens spread by the droplet or airborne routes. The strategies target primary patient and invalids accompanying patient to the dental setting who might have undiagnosed transmission respiratory infection but also apply to anyone including DHCP congestion, runny nose, and increased production of respiratory secretion. DHCP should be educated or preventing the spread of respiratory pathogens when in contact with the symptomatic persons. Respiratory hygiene cough attitude measures were added to the standard precautions in 2007. Additional information related to respiratory hygiene cough etiquette can be found in 2007 guidance for isolation precautions recommended for the preventing spread influenza are available at key recommendation respiratory hygiene cough attitude in dental setting. Implement measuring to contain the respiratory secretion in patient and occupying individuals who have signs and symptoms of a respiratory infection beginning at the point of entry to the facility and continuing throughout the visit. A pass sign at interest with the instruction of patient with symptoms of respiratory infection. 2. Cover their mouth, nose when coughing or sneezing. Use a dispose of tissue. Perform hand hygiene after hand has been in contact with the respiratory secretion. Provide tissue and non-touch respirators and the disposal of tissue. Provide resources for performing hand hygiene in our nearest waiting areas. Offer masks to coughing patients and other symptomatic persons when they enter the dental setting. Provide space and encourage persons with the symptoms of the respiratory infection to sit as far away from others as possible. If available facilities may wish place these patients in separate area while waiting for care. Provide space and encourage persons with the symptoms of respiratory infection to sit as far away from others as possible. If available facilities may wish to place these patients in a separate area while waiting for care. Educate DHCP on the importance of infection prevention measures to contain respiratory secretion to prevent these separate of respiratory pathogens when examining and caring for patients with signs and symptoms of a respiratory infection. So that was our today's video. In this video we have discussed the key recommendation for respiratory hygiene cough etiquette in dental setting. So after this respiratory hygiene and cough etiquette that we have discussed firstly in our video. So that was our today's video topic. Thanks for watching. Keep supporting. We'll see you in next video with another topic. Thank you so much. Keep supporting.